Chapter 23: Population Growth: A Global Public Health Threat Source. Mary-Jane Schneider, Introduction to Public Health. More people, more problems? Public health has long viewed uncontrolled population growth as one of the biggest threats to global health. As populations surge, so does pressure on our food, water, housing, and natural resources, especially in developing nations. This chapter looks at the trends, challenges, and what public health can do to support both sustainability and human health. The problem with population growth. The world population has exploded. In 1800, there were about 1 billion people on Earth. Today, over 8 billion and still growing in many parts of the world. While population growth is slowing in wealthier countries, developing nations are seeing rapid increases. This creates food insecurity, inadequate housing, unsafe water supplies, increased disease spread, political instability. Population growth doesn't just strain resources, it makes every public health problem harder to solve. Demographic transition. As nations develop, they go through a demographic transition. 1. First, death rates drop due to better healthcare and sanitation. 2. Then birth rates drop as families no longer need many children for survival. 3. Eventually growth levels off or even declines. Wealthy countries have already transitioned. Poorer nations are stuck in phase 2, falling death rates, but high birth rates, leading to massive population growth. Public health plays a critical role in supporting transitions by improving maternal health, family planning, child survival, urbanization, and megacities. Urban areas grow fastest in developing countries. Over half of the world now lives in cities, and that number keeps rising. But many urban areas are growing too fast for governments to manage. This leads to overcrowded housing, poor sanitation, air pollution, unsafe jobs, traffic injuries. Megacities like Lagos, Dhaka, and Sao Paulo are especially vulnerable. Without infrastructure and planning, cities can become breeding grounds for disease and inequality. Carrying capacity and sustainability. There's a concept called carrying capacity, the number of people the earth can support without degrading resources. We don't know the exact number, but signs of strain are everywhere. Depleted fisheries, desertification, deforestation, water scarcity, climate change. If population keeps growing faster than innovation, we may exceed what the planet can sustain. Public health must be part of the solution, not just by reducing disease, but by supporting education, women's empowerment, and sustainable development. Women's health and family planning. The single most powerful tool for reducing population growth? Empowering women when women have access to education, jobs, contraceptives, healthcare. They choose to have fewer children later in life. Public health supports this through reproductive health services, family planning programs, safe childbirth care, policies that promote girls' education. Every intervention that supports women and girls improves family health and slows population growth. Global initiatives and challenges. Global organizations like the United Nations Population Fund and WHO work with countries to manage population growth. But there are obstacles. Cultural resistance to contraception, misinformation, political instability, funding cuts. Still, success stories exist, like in Bangladesh, where contraceptive use soared and fertility dropped, thanks to community based outreach. Public health doesn't force change, it enables informed choice. Conclusion. Population growth is not just a math problem, it's a public health emergency. Unchecked growth worsens every crisis. Hunger, pollution, water scarcity, disease outbreaks, conflict. But with education, empowerment, and investment, public health can support sustainable populations and a healthier planet. Call to action. This video is based on Chapter 23 of Introduction to Public Health by Mary-Jane Schneider, 6th edition. If this helped you see population growth as a public health issue, share it. And in the comments, tell us, what do you think is the most effective way to manage population growth while promoting human rights?